So thank you for asking a really interesting question. So there's a lot of research on sex differences in pain. There's a lot of individual variability between different studies, but in general, women make up about 70% of chronic pain patients. There are a number of chronic pain conditions which are more prevalent in females, such as fibromyalgia, neuropathic pain, etc. And they represent about 50% of all chronic pain conditions. In comparison with men, there's about 20% of chronic pain conditions are more prevalent in men. So there's an obvious sex difference there in the first instance. There's also differences in their response to therapeutics, their seeking of health benefits and health treatments, etc. So there's lots of different sex differences in how men and women experience and respond to pain. There are many factors that can contribute to sex differences between men and women and how they experience pain. These are broken into biological factors, social factors and psychological factors. And they intersect, they're not mutually exclusive. So factors like social access to different treatments, biological factors such as hormones, genetics, immune factors, and psychological factors such as mood, cognition, etc. And they all work together to give a certain profile to the individual that can actually account for some of the sex differences that we see. Absolutely, yeah. Mood and pain are intricately linked and well known to have this reciprocal interaction. They talk to each other. So individuals that have mood disorders are much higher incidence of developing chronic pain conditions, and vice versa. If you have a chronic pain condition, you're a much higher risk of developing anxiety and depression. And even in that aspect, we see that men in general are more likely to experience anxiety-like symptoms, whereas women are more likely to experience depressive-like symptomatology. So there's sex differences at all these different levels, and this is where this interaction between biological and social and psychological factors really come into play.